Welcome to our second video on the U.S. healthcare system. Today, we'll explain the terms deductible, copay, and out-of-pocket maximum. Let's start with copays. Copays are fixed amounts you pay for specific services. For example, you may be charged a $40 copay for a visit to a specialist. Copay costs may vary for different types of doctors or services. Some may not have copays at all, so make sure you understand your insurance's copay policy before an appointment. Many health insurance policies also have deductibles. A deductible is an amount you must spend on healthcare before your insurance starts covering costs. For example, with a $1,000 deductible, you must pay the first $1,000 spent on healthcare before insurance kicks in. After that, most insurance policies will cover all medical costs beside copays. Even if you haven't met your deductible, some services may be covered by your insurance for free. Preventive care, for example, like immunizations and annual checkups, is often included without any out-of-pocket costs. Know what your insurance covers ahead of time, as this may vary from policy to policy. One other important term to know is out-of-pocket maximum. The out-of-pocket maximum, or out-of-pocket limit, is the most that one might have to pay for healthcare services over 1 year. After that, insurance will cover 100% of healthcare costs until your annual policy expires. For example, if your out-of-pocket maximum is $4,000, then between copays and other costs, the most you would pay for healthcare over the year is $4,000. While it's not common to reach a policy's out-of-pocket maximum, it is important to be aware that it is typically several $1,000s. It's critical to consider these factors when choosing your healthcare plan. Insurance plans with lower deductibles typically have higher premiums, while higher deductible plans have lower premiums. If you usually need minimal medical care, a higher deductible plan might save you money. Conversely, if you expect higher medical costs, a lower deductible plan may be more cost-effective. This concludes our second video on healthcare in the US. Join us in our next video, where we'll explore in-network and out-of-network medical services and why knowing the difference is so important.